Hello, happy to meet you. I'm Dr. BENADIBA. I'm plastic surgeon in Paris, and I do cosmetic genital surgery for more than 10 years. And when I begin to practice this kind of treatment, some company came to me to propose to test new technique like acid hyaluronic. So I'm teacher in the university for injection of deserial. And last year I discovered a new technique. It's a radio frequency and the indication for treatment of vaginal laxity. Vaginal laxity, it's not just about the way you look, it's how you feel. And the sexual function, it's now a next frontier in women's health. A few years ago, women, they don't speak about the sex problem. They was afraid to speak about this with their doctors, their gynecologists, and now they're more free and they speak easily with a plastic surgeon about a cosmetic aspect and after about sexual aspect. So it's come more and more frequent for us. We are not gynecologists, but it's come for us more and more in the ask. And vaginal laxity is the first more commonly reported physical change after vaginal birth beyond weight gain, incontinence, and stretch mark. Some women also experience of vaginal laxity as part of the natural aging process. Intraoral laxity results in loss of sensation and satisfaction for women, and I can say for men too, because it's a problem not only for the woman, it's a problem for the couple. So often the woman consults, but the problem is in the couple. So there is no one-size-fits-all solution when it comes to vaginal health. So why not offer her the best solution for each specific need? And sexual function, it's a significant unmet need, and now we can propose new technology to repair this. So what is vaginal laxity? Like the skin, the vaginal tissue is made up of collagen fiber, and during the vaginal childbirth, this tissue can overstretch, damaging and the collagen and creating a feeling of looseness, what we call laxity, and especially around the vaginal opening. So women who experience this loss of tightness may also notice a decreased feeling of sensation and sexual satisfaction during intercourse. This change can affect women's overall several sexual health and are a quality of life issue for millions of women surveyed a year. In a survey of over 400 women who had vaginal delivery, nearly half report some level of concern with vaginal looseness, otherwise known as vaginal laxity. So it's a real problem, but not a lot of women speak about this. But we have to know that there is a lot of women touched by this. So vaginal laxity is a condition where the trauma of the vaginal from the childbirth result in overstretching and loosening of the vaginal. Issue with sexual function result primarily from introital laxity, general not laxity in the canal. So the action have to be in this area, in the introital of the vaginal. Trauma of the introital tissue may lead to reduction of sexual satisfaction, change in relationship with sexual partner, and negative impact on overall quality of life. Some women have also experienced with vaginal laxity after natural aging process like menopause. So in this slide, you can see that in USA and in Japanese country, a lot of women are concerned about this problem. Half of women in USA in the study, and third of the women are concerned in Japan. It's important to understand that the introital tissue is in connection with the clitoral body and integrated in sexual function. It's why the radiofrequency have to use in this area, and you have to introduce the product, the tips into the vaginal to have an action. If you are only outside, you can have an effect, but it's very difficult, and this slide shows you the anatomy, and you can understand how it can have an action on the muscle if you are exactly on the good area. Here it's a compare of the husk in feminine rejuvenation. In French we say restoration, vaginal restoration. Actually we have a lot of product to propose. It's new. It's not only surgical, it's not surgical and surgical. For me, the first ask was labiaplasty. Of course, I'm plastic surgeon, so women ask me for cosmetic surgery. After, they speak about some sexual problem like clitoral hood, because if the clitoral hood is too important, it reduces the sexual sensation. And when you begin to speak with women about sexual sensation, they ask you, I can do something more? I can improve with injection like hyaluronic acid. It's possible to treat dryness, but sometimes it's not enough. They feel something, it's anatomic. They feel to laxity, and at this moment, injection, surgery, it's possible, but it's too strong surgery. It's difficult surgery. What we can propose? We can propose Kegel exercise, of course, but sometimes it's not enough, and physiotherapists are not so easy with this exercise. Laser can offer an indication, and we have radiofrequency, and especially this system, VIVEVE, it's special for this area and action in introductus. So the VIVEVE advantage, it's three advantages. It's a special treatment with monopolar radiofrequency, and we have a deep and precise heating with a radiofrequency energy treatment on the 3-5 millimeters on the vaginal tissue. It's enough to have an action. Integrated cooling precisely controls the delivery on the membrane of the treatment tips. It's to create a reverse thermal gradient to protect the surface of the tissue, trapping deeper tissue. Capacitive coupling distributes the radiofrequency energy uniformly across the surface of the tip rather than at the edge of the electrode, resulting in a controlled and consistent delivery of heat into a target volume of tissue. It's very important to deliver the radiofrequency exactly what it needs, because you can have burn and side effect. If we compare this radiofrequency to laser, it's completely different, because it's a single treatment. It's a quick treatment, only 15 minutes, 20 minutes sometimes, with no pain, no anesthesia, and most significant and long-standing investment in treating vaginal laxity. It's a standardized technique because the machine shows you exactly what you have to do. I'm going to show you a short video. You will see it's very easy, and you can delegate this technique. The radiofrequency with cooling is able to treat full thickness of introital tissue, where substantial tightening improves sensation. If we compare the action of different kind of device we have on tightening, VIVEVE have the deep action. It needs only one treatment, and we have the result near 1 month. So it's very quick result. If you compare with COD laser or erbium laser, it needs sometimes 2-3 sessions. it's not so, it's painful sometimes, and it's not immediately. And the tightening, it's not the same because you don't have an action on the muscle. You have only an action on the epithelium. So you can speak about tightening, but it's not really a tightening. But it's very useful for dryness. So each machine is useful for one indication. If we compare with another radiofrequency with unipolar, you have no cooling. So if you have no cooling, you can burn. So you have to move, always move. If you stop to move, you can burn and you can have side effect. Here you have a slide show the action of the radiofrequency. 1, depth of penetration. 2, safety, no ablasi, no fractional, no surgical. Easy to use. There is no post-treatment issue, and a precision on the depth and the field of impact. Here, a small video to show you exactly what's happened when you deliver the anesthesia. I'm not sure you can hear, but this video shows the action on the collagen. You have an action on the fibroblast. You need the first month, and you create new collagen, and you have the tightening effect begin after 1 month. The maximal effect is after 3 months, and it can be good for more than 1 year. Here you can see the simulation of the fiber before and after treatment. Here it's a histologic study show the action of radiofrequency on the skin, and you can see that after 1 month, 1 week, 3 months, the augmentation, the activation of the fibroblast and the granulation tissue or creation of collagen. So the procedure is very simple. Here you can see a short video. So it's you don't need anesthesia because it's painless, no problem. Here you have the handpiece, and you have a special color and sound show you when you can deliver the energy. The machine don't give you the energy if you are not in the good position. So you are handpiece flashing light, audible tone, and the green color. The technique is very simple. You have to do all the points of a clock, but not at 12. Because at 12 you have the urethra and you can create some damage, so it's better not to do this. You can do it slowly, and you have to do 2 or 3 rounds into the vaginal. So it takes nearly 20 minutes to have all the sequencing. The result we have with this machine show that was a test in 4 countries, Italy, Spain, Canada, and Japan, and more than 150 patients was treated with a follow-up still April 216. The efficacy was measured by vaginal laxity questionnaire, female sexual function questionnaire, and female sexual distress questionnaire. There is no serious adverse report at this date. That's very interesting is to show in this study you have a compared between patients from US and patients from Japan. At the beginning of the graph, you can see the sex sensation of the patient was before the childbirth. You see it's 5.3 for US, 4 for Japanese girl, and you see the dip after the childbirth. it's reduced of half sensation. And after one treatment with VIVEVE, with radiofrequency, you have an enhancement like before the childbirth. That's very interesting, and it stays for more than 6 months, 1 year, you have the same result. So in this study, it was similar. We have 24, 30 women in Japan. The goal was to determine the response with radiotherapy frequency. All the treatment was the same, energy, and all the patients have a statistically significant improvement in vaginal laxity to pre-childbirth levels at time interval, and no side effect. So what says the patient after VIVEVE procedure? Some say, oh, I do a lot of plastic surgery, but for me, it's maybe the best thing I ever done for myself. Of course, when you do a breast implant, you are happy, it's nice, you feel more woman, but sex life is very important. Of course, if a woman is very young, after one childbirth, it's so disturbing that it's very important, more than a plastic surgery. Some women say, oh, I have more sensation during intercourse, it's definite tightness. Some say the feeling was coming back, which I almost forgotten. So all women feel satisfied with this technology. So where is this technology actually? For me, I'm plastic surgeon, it's come the last one maybe, because I begin with surgery. It's normal, I'm plastic surgeon. And after, like I told you, women speak about sex. If we can improve sex but reduce the clitoral hood, and after they speak about dryness, and they come easily to speak about pleasure, if we can inject G-spot, and of course the vaginal laxity. So the indication of this technology are a real future and will give to our patient very good satisfaction. Here we have a compare of the benefits of surgery or not surgery treatment, and for us, it's an easy treatment with one session, with no pain, with no problem after, with no stop of sex, and for physician, it's an easy technique with good quality of revenue. You can delegate this technology, and it can increase your passion. Okay, thank you for your attention.